think it's important that every single treatment that we do, we follow the same sort of pathway. So, you know, it's not overly complex stuff. It's getting to know patients. It's being able to say, like, what is it particularly that you are anxious about the dentist? Is it smells, sounds, sensory things, particular memories? And it's been able to kind of tailor the way that we treat you to cope with that. And if it doesn't smell like a dentist in here, we have lots of different things that will distract you, our earphones, to not listen to the sounds, you know, that we can watch a film while we work on you. There's lots of things, but I think trust is always key. If we, you know, can back it up and say, look, this isn't going to be painful, and we deliver that, then it just makes life a whole lot easier. So the best way to make things pain-free is good technique with local anaesthetic, making sure things are properly numbed up well. We've got complex kind of advanced systems to do that. We have a really clever system which uses an electric injection technique. It's a much smaller needle, it goes in much slower. It's generally far more comfortable, but gets a really good numbing effect. The key thing is as well is that the patients are in control. You know, if you say to me, I'm feeling something or I need you to stop, you raise a hand and we'll stop straight away, and we do it every time. And I think just having that knowledge that, you know, I'm in control, I can make this stop if I need to, it's so important, because so many bad experiences that other people have had, myself included, from when I was younger at the dentist, is that loss of control and thinking, I want this to stop, and it doesn't. And you know, those kind of memories are particularly what causes people to be potentially anxious, because at a base level it's often almost sort of a traumatic experience in childhood, and it's proper trauma that people have gone through. And I think that we have to respect that and not just sort of say, oh no, you know, you should man up and get it done. You know, these people have had bad experiences, and your body's reaction is to escape that. It's fight or flight. Your adrenaline kicks in, and it turns these things that seem like not a big deal into a massive issue. And that's how phobias work. They blow things out of proportion to the point where our immediate response is to panic. So I think it's so important to understand that and appreciate it. And I think when patients know that they're not being judged, and that we kind of understand exactly where they're coming from, I think that is really a benefit to them. So yeah, trust, good relationship with the patient, and then taking our time, letting things numb up, letting the patient be in control. These are the sort of best ways to really to get to a point where the patients are comfortable, not in pain, but also getting to the point where they're happy to come here, because that's really important as well.